Our team topic is file-based physician dashboard for managing opioid prescriptions. There is a sharp increase of drug overdose mortality in US in the last 20 years. Drug overdose mortality is becoming a serious public health problem. Opioid overdose is a major contributor, accounting for 75%. In the last 20 years, opioid prescription increases more than 4 times. Abuse of prescription is a major cause of this crisis. To fight for this crisis, prescription monitoring system is urgently needed. A file-based app could be a big help.
Let's begin by identifying the problem. Our target users struggle with accessing a patient's complete medical history for all of their health providers, and easily being able to view information related to opioid prescriptions in one place. An additional issue is that there is sometimes too much information to process in a short time, leading to lower quality prescription decisions. So why is this relevant now? Between 2000 and 2016, there were over 600,000 recorded deaths from drug overdoses, an average of 115 deaths each day. This count has increased fourfold since 1999, an alarming statistic which demonstrates an urgent need for better informational support for physicians to better manage opioid prescriptions. The large rate of opioid-related deaths in America has sometimes been referred to as the modern plague. Studies show varying risk factors, including education, age, and employment status, as parameters which can affect a person's addiction. This figure illustrates the number of opioid prescriptions per 100 people in each state. It is interesting to note that this rate is highest across the southeastern region of the United States and lower than average across the Midwest, New England, and California. So what is the solution to such a widespread and growing problem? We, Team Visualize, propose a real-time interoperable dashboard for physicians, which will retrieve and display opioid-related information for a patient in the EHR, including pain-controlling prescriptions, opioid-related healthcare encounters, and more. Our objective includes integrating other data, such as comparative prescription patterns with peer physicians or state prescription guidelines. Based off of the data, our application will score patients on their addiction risk, creating a highly usable and intuitive platform. Next, what does success look like? Our application will be designed and implemented using a user-centric design process and validated with targeted end users using HCI methods such as usability testing. Our goal is to create a production-ready prototype that is ready for implementation, backed by solid software architecture and design, and delivered with comprehensive documentation for both technical and end users. This Gantt chart illustrates our project schedule divided into 4 phases: project conception and initiation, requirements gathering and prototyping, the development phase, and finally the testing phase. Since many of the tasks are unknown at this point, this Gantt chart will be updated as the semester continues along. This first deliverable marks the completion of phase 1 as we prepare to enter the research and prototyping phase of our project. Thank you from all of us at Team Visualize, and we look forward to updating you as part of our next deliverable.